How could BYU become the new Johns Hopkins? How could it catalyze or help to usher in a new era of health and wellness? I'm Dr. Chad Swanson. I'm an emergency physician, and this is my daily 10-minute health systems transformation video. When Johns Hopkins was first founded in the late 1800s, it did much more than simply train outstanding physicians. It certainly did that. It contributed in a major way. It catalyzed a new era in health and medicine by focusing on scientific medicine, by linking medical schools to hospitals and linking medical schools and hospitals to research. And that model had a significant impact on the rest of the country, on other medical schools over time, and on communities throughout the country as physicians graduated, practiced surgery, formed hospitals, and practice medicine around the country. In a similar way, new medical schools like Brigham Young University could have a similar impact on our nation's health, I believe, but it would take bold strategic thinking. Now, you may be in a position where you really don't care that much about Brigham Young University, and that's totally understandable, but I do think the ideas that I'm going to talk about are applicable to other new medical schools, but also any organization that would like to be involved in catalyzing transformational change. So I hope this is helpful. A few caveats. One is that while I have been in the past adjunct faculty at Brigham Young University, and I really have no role whatsoever in these conversations about the medical school. So I'm simply an interested outsider who sees this as a potential opportunity for significant change. I do have a master's in public health from Johns Hopkins, so I have a population health perspective. I also have published in high impact journals like The Lancet on complex systems thinking. And I've been writing a book for over the last 8 years that's set in the late 1800s and early 1900s in Raleigh, North Carolina, about two physicians. So while I'm not a historian, I do have some knowledge about the history of medicine in this time period. Finally, I view these daily videos as conversations, so informal conversations. While I do a significant amount of research and I try to make sure all the facts are correct, I'm taking a bird's eye view. And so I appreciate your criticism, questions. I'm happy to clarify or even correct what I say. So the first thing that needs to happen, I believe, that we can learn from the Johns Hopkins perspective with new medical schools like Brigham Young University is the importance of an early, bold, clear vision. So for Johns Hopkins, that was to have a premier hospital with the best advisors in the world to link science to medicine and provide outstanding clinical treatment. I would argue that the bold vision that's needed today is health and well-being for all at the lowest possible cost to the system. That clear vision needs to drive everything. It needs to drive who is hired as opposed to someone that might have a significant amount of impressive credentials from the current flawed system, or friends or acquaintances of the people that are doing the hiring. The vision should also drive the institutions. At Johns Hopkins, there was a new medical school. There were new medical specialties. There were new ways of looking at hospitals. There were new research institutions. All of these new institutions were developed because of the vision. The vision drove those institutions as opposed to the status quo driving the needs. As far as Brigham Young's medical school is concerned, that bold vision will have to be communicated early because the dean has been hired, and now the dean, I'm sure, is already involved in conversations and thinking and even interviews perhaps with other leaders for this new medical school. And if the vision is different than a vision of transformational change to accomplish health and well-being for all, then those that are hired might be accomplished and very knowledgeable and skilled in the current flawed system, but won't have necessarily the bold, innovative spirit to transform the system. A few specifics, if this vision is adopted, that is health and well-being for all, a few things to consider. First is that only 5 to 20% of our health status is determined by doctors and hospitals and nurses as they're now practicing. So that means 80 to 95% of our health status is determined by other factors like our environment, our social context, our diet, our exercise, etc. And so that would require a significant amount of collaboration with other disciplines. It would require a rethinking of how health and healthcare is delivered in communities. A second consideration is that I would argue that our health care system was founded on and has been dominated by what is called biomedical reductionism. So bio obviously refers to biology, medical to medicine or treatment or surgery and drugs. And reductionism is the idea that we can take either the human body or the health system itself, divide it into its constituent parts, and then fix each part independently. So if you have a problem with a gallbladder, we open up and we remove the gallbladder. If you have a problem with a specific healthcare provider, then we deal with that provider separately. I would argue that we need a complex social systems perspective, meaning that we consider the relationships between the different systems in the body or the relationships between the different parts of the system. And all of those parts of the healthcare system, the health system, adapt over time to meet the final goal, which is health and well-being for all at the lowest cost to the system. So that's the second important consideration when we think of this bold new vision. The third is the importance of partnering with families and communities. So we've the story we've told ourselves, a powerful story, is that health is determined by doctors and nurses in hospitals. We have to go to these places to get healed. I work in an emergency department, whereas we know that much of health is determined by what happens in households and what happens in communities. And so a new bold vision for health and well-being would involve doctors, nurses, public health, education, research, partnering and developing relationships with and increasing the capacity of families and communities. So my recommendation, which can be taken with about 1/4 of a grain of salt, but my recommendation would be that this bold vision be communicated with the entire university at Brigham Young University, because there's a public health department, there's a fabulous nursing program, there's sociology and psychology and a business school and law school. So there's communications, etc. There are a number of disciplines that impact health. And so this bold vision of health and well-being for all at the lowest possible cost should not just be the vision of the medical school, but there could be a new conceptualization of the university itself as a complex system with all these different parts as departments and interacting in a way so that the university itself could become an important catalyst or contributor to transformational change within the broader system in our country. So that might mean the formation of an institute of health systems transformation. I would recommend a major in health systems transformation, a minor in health systems transformation. I think we need bold steps. So I would recommend that all pre-medical students that get accepted to this new BYU Medical School major in health systems transformation. Then this would of course affect who is hired as new faculty for the medical school or other positions. My recommendation, but that these be not necessarily those that have excelled in the current system. So those that have published or accomplished things within the current flawed system, but those that can think outside of the box, so that might be bold, that might be unconventional. And that's what happened with Johns Hopkins. The original faculty were all in their 40s when they first started considering being involved in this. They were in their even 20s in the case of William Welch. and in their 30s. And then finally, I would recommend, with a bold vision, there opportunities emerge, often surprisingly or unexpectedly. So there may be someone, a wealthy person that can donate to this cause, or a different university that wants to partner, or the state of Utah could rally around these ideas to catalyze and usher in a new era of health and medicine. I'd love your thoughts. Thank you very much.